you talked about fluoride in the water. I just did a podcast on the fact that the government came out with saying that fluoride in the water is causing low IQ in our children. Well, guess what helps combat the fluoride? It's the iodine. So iodine's helping nitric oxide. Nitric oxide is diminished by fluoride. I wonder if there's a connection there because it's this trio, right? With nitric oxide, fluoride, and iodine, just one little aspect of it. And I'm laughing too because both of my parents worry about their heart health. And I said, what toothpaste are you using? Crest. I mean, literally the OG of the worst type of toothpaste that they can. I ordered them some fluoride-free toothpaste. I said, get rid of your mouthwash and let's see what happens with the new toothpaste and no mouthwash. So why don't you talk a little bit about how that is one of the simplest things to do to increase your nitric oxide?
Well, it goes back to the microbiome project. The bacteria that live in and on our body outnumber our human cells 10 to 1. So these bacteria that live on our skin, in our gut, in our mouth, different body parts are there to do things that we as humans can't do. They're called symbionts. They're providing important metabolic cofactors and substrates that the humans don't have the enzymatic machinery or the genotype to produce. So when we eradicate the microbiome, we get sick. There's clear evidence now, and that's why we don't use an antibiotic every day for the rest of our lives, because of the destruction it causes on the gut microbiome and causes systemic disease. Well, those same principles apply to the oral microbiome. If you're drinking fluorinated water, using a fluoride toothpaste, or using a fluorinated or antiseptic mouthwash, that's just like taking an antibiotic every day, and it kills the microbiome. It shuts down nitric oxide production. We see an increase in blood pressure in people who use mouthwash or fluoride toothpaste. And so simply stopping those practices, eliminating fluoride from your toothpaste, if you're using mouthwash, you have to stop. And then simply getting a home filtration system that removes the fluoride, the chlorine, the fluoramines, and all the other toxic things that you find in municipal water. Now that's somewhat cost savings. Yeah, home filtration systems cost a little bit, but stop buying mouthwash. Buy a fluoride-free toothpaste, which is similar price points. But these are all cost savings. But no matter if it's cost savings or not, you cannot put a price tag on your health and well-being.